Good morning, everybody. Thank you so much for joining us again, and a special welcome again to Dr. Ann Gillies from Canada. Anne, you're here to stay. Thank you for coming and joining with us and sharing. I am hoping that this will go out to the International Federation for Therapeutic and Counseling Choice, but also to Core Issues Trust, those who follow us on Facebook and YouTube. And then thirdly, to the wonderful young people who are finding transformation and help and are determined to speak out loud. We call them X Out Loud. And they are young men and women who have got to the point in their lives where they're actually tired of being dictated to in terms of how they identify and how they express themselves. They don't buy the fact that they're not authentic just because they say they are ex-gay. So I think they are going to appreciate what you have to say today. The title of this program is Around Trauma and the Role of Trauma in the Development of Homosexual Experience in Men and Women. Now, I know that you are particularly specialized and interested in trauma. So could you just give us a flavor of what it means when you are a trauma therapist? What does that look like in terms of practical work that you would do with your clients?
Well, first of all, I feel like when I graduated, I got thrown into trauma work very quickly and very quickly. And I recognized that much of my education had missed the point in the fact that we were all about diagnoses. But the reality was, and I feel like for me as a Christian, that God really led me to understand that the reality was that what we would call a diagnosis was often a result of acute, chronic childhood traumatic experiences. And so out of those traumatic experiences, and especially out of complex trauma, which I've written on this. I have a book on this called Deep Impact, integrating theology and psychology in the treatment of complex trauma, because I think there is such a need of understanding spiritual as well. We want to treat the whole person. So what happened for me was that I began to see very quickly in therapeutic experience that people who came to me, if I just got out of my mind that I needed to label them with something, that I could help them explore what some of the roots were. Now, we take that for granted now. I mean, because that's become very much part of the therapeutic experience. But when I started, it wasn't at all. And therapists really didn't delve into, and I'm saying this generally, of course, there were some that did, delve into the histories of their clients. And so that's kind of where I started. I found, I mean, this sounds, I almost feel like I have to apologize for this when I have told people, but I loved treating complex trauma. I love it because I love people and I want them to be well. And so many of my clients were Christians because I advertised as well as a Christian therapist. And because I found that Christians were marginalized. If they went to a therapist, it was like their experiences were not authentic, right? It's like we kind of, even though we're now trying, or we have for the last decade or two, tried to bridge that gap in therapy and introduce therapists to some spiritual insights, it's still different if you're a Christian and a therapist. Anyways, to say all of that, my experience with trauma spans many years. And so for my understanding and experience, that individuals who have experienced chronic sexual abuse, particularly at the hands of someone that they know. And we know now that most sexual abuse is done by someone the child already knows, often a family member. You wanted to say something, I think,
Yes.
Mike.
Before you delve too deeply into this, because I think it's going to be fascinating, can you just distinguish between complex and what I presume is simple trauma? What do you mean? What's the difference?
So, well, there's acute traumatic stress disorder, or PTS. Sometimes it's called post-traumatic stress, which is a normal reaction to an abnormal situation. So if someone's in a serious car accident or witnesses a crime, that they will undoubtedly have some kind of psychological reaction to that experience. And it is called post-traumatic stress. It lasts for less than 30 days, but it does, there's some definite symptomatology. So you don't sleep well. People who have addiction issues, substance abuse, tend to go back to that. Certainly, I also work with the Billy Graham Rapid Response team in this area of trauma, and so we encourage people, to practice good, normal behaviors, right? Get lots of sleep, eat well. That's the simple trauma, I'll call it. But then we move to the next stage, which is post-traumatic stress disorder. So that is a traumatic experience or event that goes past the 30-day mark, and it's diagnosable as post-traumatic stress disorder. And this is something, this overlaps a lot actually, with complex traumatic stress. So the symptoms, the post-traumatic stress, so this is where you have military who have witnessed horrific things. And just so someone who has experienced an attack, all of those kind of things. Usually it's with post-traumatic stress, it's not a chronic condition. It is more of a one-off experience. So if someone witnessed a murder, they can have post-traumatic stress. So their symptoms would go beyond the 30-day mark, and then they would hopefully they would get some kind of therapeutic counsel. And often they receive drugs. I never prescribed. I really believe that there are some drugs that can help mitigate the nightmares and those kind of things. But I think if people can be guided therapeutically to resolve the issues, they're far better off.
Anne, now we're talking about simple, what were the three? There were three categories now. Simple.
Right. So the first one is post-traumatic stress, which is the symptoms last under 30 days. And it's a normative reaction to an abnormal situation, whatever that may be. Some people experience stress on different levels, traumatic stress. So there's that one. And then we moved into the post-traumatic stress disorder. So the literature for post-traumatic stress comes out of war trauma mostly, but it does encompass so many more. And we hear PTSD a lot in the media, and certainly people say, oh, I have PTSD, and many people really aren't understanding what they're saying. Others do. So it's usually an isolated traumatic event. It can be military, certainly military who have witnessed horrific things will encounter PTSD, and that's become very, very much known in the last while. And the difference in these is that the trauma source is not usually from an intimate relationship. This is where things change a little bit. So soldiers are trained to go to war, and mentally, psychologically, they actually are trained as well. Now, that doesn't mean because you're trained, you will not have psychological issues with trauma. Of course not. But the PTSD group of symptoms would correspond with war-related trauma, would natural disasters, a single rape as an adult, physical injuries, and even different witnessing of such things. So that can create the symptomatology of PTSD. When we look at the literature that supports a complex traumatic stress diagnoses, if you want to call it that, the American Psychological Association, APA, CPA, Canadian Psychological Association, have not adjusted this in the DSM, the Diagnostic and Statistical Manual. It's still lumped all under PTSD, but there is a big movement to change that. So what's the difference? Number one, multiple traumatic events. And as I said before, chronic trauma. So also the trauma source is from intimate relationships, usually family relationships. So what I see on complex traumatic stress, and certainly my practice on sexual abuse, childhood sexual abuse, is definitely family members, uncles, grandfathers, even fathers, more predominantly stepfathers. And so you can have childhood sexual abuse certainly comes under this.
So then,
complex.
can I just jump in there? Does that mean if somebody experiences an intervention from somebody who basically abuses them, that is complex trauma?
Yes, well, it can be. I mean, if it's chronic, so here's the difference. So for a child who has been sexually abused, say by a neighbor or a teenager, because we're seeing more and more of that, and that child has a secure attachment relationship with their own parents, and they immediately go to their parent, they talk to the parent helps them, gets them help, the parent defends them, the parent doesn't try and deny it. That child will in all likelihood not develop complex traumatic stress. But what we habitually have seen is the trauma, sexual abuse particularly, or neglect, severe neglect, or emotional, really severe. I'm not talking about, someone yells at their child, or physical abuse, severe physical abuse that is left. The child never discloses. The child doesn't go to anyone, and they never receive help, and they the offense continues to happen over and over for years. So with my own children, this happened. And that's, I think, one of the reasons, well, it is the big reason that I got into trauma work, because I didn't go to school to get an education, to find a career. I went because I thought, how can I help my children? That's why I went. And so what I've learned in the process is incredible, but children who have been chronically sexually abused, who've been threatened with their lives, as my children were if they ever told me, or their biological father, which is not usually typical, but their biological father threatened them with their lives or threatened that he would kill me. And so they stayed quiet. And I never knew, I'll tell you, that's been a terrible journey, and I'm kind of digressing. But that level of intimidation on the child, it just incredibly and repeatedly suppresses. And so they have no outlet, they have no one to talk to, and they actually start putting up walls and we can get into more of that later, but that's more toward the therapeutic technique. But yes, so there's a difference between PTSD and CTSD, and it's more on a personal relationship, and it's ongoing, and it's usually for those who have been kidnapped, child slaves. I mean, it's horrific. It's horrific, and it's not talked about.
Can you now just take it one step further and look at trauma in relationship to the development of homosexuality? Because I think my understanding is that you would accept that when we're looking at homosexuality, we are looking at developmental issues. This is not something innate.
So what I would say is, so here's what I believe about that. Yes, largely environmentally produced or influenced, for sure. I would say there's several. I've done papers on this in the past, and certainly my book on Closing the Floodgates identifies some stuff in there. Number one is that could there be any kind of genetic influence? That's a possibility. And I would say that gingerly, because I would think it only applies to a very, very small percentage. And is it genetic? Here's the other thing. Or is it trauma in utero? And what we found in other research is that in the second month of pregnancy, if the mother is highly traumatized, has a traumatizing experience, that child actually will be more predisposed toward homosexuality, which is quite interesting. It's the lack of testosterone, the testosterone bath that comes in that time, but that affects a very small percentage. The other, and it's recognized that homosexuality has many, many different influencers, and so biology is perhaps the least of all. And I would say that totally, that it probably is the least of all. There is a large percentage of the gay and lesbian community, and tremendously large percentage of the transgender community in the past, particularly, that have experienced sexual abuse, chronic sexual abuse. I would say that many, many, many of them have diagnosable complex traumatic stress disorder. The sad thing is that there's a real movement to repress that, even talking about that. So here we have, go ahead, because I do get off on tangents.
I was just wondering, in the current climate on banning therapeutic choice, how do those who support such bans argue about this, the state of individuals who clearly have experienced abuse, and then their own kind of story indicates that from that trauma that they experienced, they then began to feel homosexually drawn to people of the same sex. What do our opponents say about banning therapeutic intervention, that would change that?
Oh, they want to totally ban any intervention. And let me just share something with you.
Those who've been traumatized in the way by somebody else, they want to ban it even for them.
Well, if a person in the LGBT community or who has unwanted same-sex attraction for whatever reason, and the person identifies that as a result of chronic sexual abuse as a child, or any of those things, then yeah, like they are not going to be encouraged to seek help. I don't know how they're working with trying to keep traumatized trauma survivors from seeking help. But one of the things that I've heard repeatedly is that number one, they minimize the effect of childhood sexual abuse on those with unwanted same-sex attraction. I was just going to read something that says,
Go ahead.
it's in one of my articles. It says, childhood sexual abuse still remains closely associated with same-sex attraction in the development of homosexuality. In a 2005 study containing data on life stories of 24-year-old males, what was found was that sexual abuse prompted the boys. So these are adult men, but they're talking about what happened to them. And it prompted, the sexual abuse prompted them to question what had happened to them and did they invite this? Because were they some way, were they gay and didn't know it? Or was there something about them that was different? And you know, trauma, no matter whether you're heterosexual, homosexual, trans, whatever, trauma like this just really shuts down the normal development of gender identity. And I will say this out loud, the normal trajectory seen throughout psychology for 100 years is toward a heterosexual life, because it has been well supported and well documented. And so normal development of gender identity, self-esteem, and self-concept is all disrupted by childhood sexual abuse. So the boys that were interviewed as men, they felt flawed. And they felt that their behavior signaled that they were less masculine. And these are boys. These are young children, you know, having to think about these things. And they felt more vulnerable, less adequate as individuals, as children, and as male. Female with a lesbian, it's a bit different. Not that they haven't had traumatic experiences. Usually there's a father-daughter thing that's going on, or perhaps, and I mean, I'll get hate mail for this, that we dare suggest that, you know, there's a mother-daughter attachment disorder, but attachment has so much to do with this. Attachment and trauma go hand in hand. And so with these boys and men, what they said is that they feared that the sexual abuse that they'd had would make them homosexual. And as a result, it kind of began as a self-fulfilling prophecy, you know? So they must have been homosexual, or this wouldn't have happened to them because it's male on male. And therefore, they end up walking that out, because sex tracks in the brain, especially a young brain. And this is so concerning given our sex ed and all of the thoughts, the behaviors, what we're putting in. Sex, thoughts, pornography track faster than drugs in the brain. And so this means that young children who are being exposed to such things, and especially if they have been raped, that's what I'll call it. My children were raped, and by their biological father. And it took me years after my divorce and subsequent remarriage. I have a wonderful husband. I now believe that men can be men and be honorable and have integrity. But it took me years to acknowledge that my husband was a homosexual pedophile. And that will bring out the worms out of the woodwork, just saying that there could be such a thing. But he was. And when I finally asked him to leave, that he certainly pushed himself right into the middle of the community. And nothing was ever, he actually, we went to court and he was acquitted.
Wow.
And that was horrendous. Anyways, we get all over the place here.
Well,
sorry about that. I did the rabbit trail.
Really, that history has a part in your own development as a professional dealing with trauma. Yeah, that would be correct.
Yes, I think so, because not that I don't hate the LGBTQ community. I have a lot of respect and regard. Well, people have to earn respect, so in anything. But I think, I see such a large majority of them very wounded and from past traumatic experience, and now no longer being able to access the kind of help they've at least been able to seek out in the past, when they recognized that this problem was far deeper than just something that can be explained away. So yeah, my history does have something to do with that.
And I wanted to ask you, and maybe this will take us in a direction that we have to come back to another time, but how does OCD relate to trauma? Is there a link? When people become obsessional and compulsive, is there a link between trauma and that particular position in life?
I think it's more than just OCD, and we will come back to this because I have several charts, and so we'll probably have to do another lecture thing maybe. But I said this initially, that I learned quickly that trauma actually is at the root of many of the diagnoses we see, ADHD particularly, OCD, and many other, bipolar, borderline diagnoses, for sure. Usually that's very deep.
Now, the reason why I want to ask you about this is because I see in my own work a lot of HOCD people who have a deep fear of homosexuality and have become obsessive and compulsive in the way they think. Have you come across that?
Not particularly, but I could see that happening because so they're trying, so they actually, are you saying that they become so oppositional to homosexuality? Is that what you're saying?
They
fear it.
And they are so afraid of being homosexual that they seem to develop all sorts of things around this to deal with it. But actually, they're not even close in some cases to acting out on this. They're not even having fantasies. It's all around fear. And I wonder if there isn't some trauma somewhere relating to this.
Exactly. I would say yes. So now, whether that is acknowledged, whether it's even understood, and I mean, one of the things, the very most important things that we need to understand about chronic complex traumatic stress is the area of dissociative identity disorder, and the whole area of dissociation. And so it's on the continuum as well. So when we think of PTS, PTSD, CTSD, think of my brain just went. What was the word I was just saying? DID. So dissociative identity disorder, which is at the very end of that continuum. But dissociation in there's a normal dissociative experience. If we if you're an offender bender, you may dissociate for just a moment or two. It's like an amnesia that happens, and you don't remember. You're not able to remember the point of impact or the noise or something. That's one area, one end of the dissociation scale. So as you go along, the more complex the trauma, the more chronic, the more the ability of the brain, and I think it's a God-given ability, to dissociate. That means to compartmentalize. And so there are people, and I would not hesitate to say this, within the LGBT community, certainly within within the homeless community, within prostitution, all of those people who have experienced severe traumatic experiences probably have at least some serious element of dissociation, which means that they may not even remember parts of the abuse or when the abuse actually started. And so it gets very, very hard to pinpoint unless you can get to the actual root. So the fear can be there. That's what you see is the fear, because the person doesn't understand. They haven't been able to unlock what's behind that wall. Does that make any sense?
Yeah, no, it does. Can you say something about men and women? Are they different in terms of how trauma works and in relation to the development of homosexuality, or is it similar?
First of all, when you said the difference between men and women, I went, oh yeah, I can talk about that. But when it comes to gay and lesbian experience, I think there is a huge difference. Remember that this is also binary. Like, they believe in a male and female, whereas when you get into the transgender, that's a whole other kind of issue. But there's a difference, of course, in experience. And I think for homosexual men who have been raped or sexually abused by other men, I think there's something that is very deep in the psyche that, as we talked about a few minutes ago, that these adult men talking about their childhood experiences, it shatters them. And with women, I think what I see, there's often there's a shattering as well. It doesn't have to be, I don't think there's the same level of sexual abuse, same partner sexual abuse at childhood, but it can be a compilation of different factors as well. So I'm not as experienced in the study of lesbians, so I'm a bit more hesitant to talk about that.
Okay.
So I want to stay where I'm more experienced. So what I believe is that the shattering that takes place just so apprehends normal development and the normal thought processes.
Now, a lot of people who will watch this are not professional. They haven't trained in psychology or in psychotherapy, and many of them will be people who have experienced exactly what we're talking about. What would you say to them in terms of beginning to unpack what happened? When they've come to the realization that something bad happened to them and they're not happy. They don't know what to do in terms of dealing with this. What's your advice? Where do they go?
Well, I mean, it's twofold. I think, before the last 5 years, they totally had freedom to seek out a therapist. Maybe it's 10 years, but even 5 years ago, they could seek out a therapist to deal with what they were experiencing, the symptoms, right? So the traumatic experience symptoms. I'm not going into all of those right now. It's just too long of a list. But they could actually talk to someone and get to the root, and they still can do that. It's the minute, though, that they mentioned that they have had same-sex thoughts and attraction that the therapist is now shut down. So it's very hard. And the other piece is, this is what pastors and priests have done for decades. Before there were therapists, who did we go to? And there's not enough therapists in our world to treat and help people. It has been the church that has helped. And I know that the church has also done things that haven't been helpful. So have therapists. I mean, for psychologists and psychiatrists, it's been a learning curve, since the 1800s. It's not been with any perfection. We learn as we go. And that's in every kind of thing, but especially when we're dealing with the mind and the psychology. So for those who are out there listening, I just want to say that there is hope. And no matter what we are or are not allowed to say to you before being charged, I want to give you that hope. And that hope comes from God. I mean, honestly, it's not easy to leave something that you're very, very involved in, even if you want it. So think of an alcohol addiction or anything like that. It means retraining the brain. And you can do that because neurologically, the brain is very flexible. So it means that you'd have to do some steps along the way. And at the same time, for Christian believers, there is a lot of hope. And I hope that pastors won't shut themselves down from helping people.
So tell us the steps, Anne. I mean, what should they do? Now, they don't have the option to go and share their heart's concern about same-sex attraction, okay? But they do have access to maybe godly pastors or safe friends who, are going to be close to them just because they're good friends and they're safe. They're not going to be, re-traumatized by some kind of advance from those people. What are they seeking to do to retrain their minds exactly?
Well, first of all, before you go to retraining the mind, I think we have to be cognizant of what symptoms we're having. And sometimes it's just talking to other people, opening yourself up enough to say, is this something you experience? I'm having all these thoughts, or I am feeling terrified in these situations. There's all kinds of things that happen, and not just with same-sex attraction, with lots of people who've been traumatized. So to start on that level, if you recognize that you have experienced deep trauma of one kind or another in your life, or that can mean, it doesn't have to be sexual abuse. It can be the loss of a parent at a young age. It can be divorce, traumatized as a child. There's all kinds of different traumas, but they connect often with attachment. So something that is attached to the parent figure. And so if you recognize, gee, that was me. I mean, and now saying that, every child that goes through divorce, of course, does not have sexual issues, but many of them do, whether it's heterosexual or homosexual behavioral issues. There's a lot of that that happens. And so we need to begin identifying kind of things that have happened to us and be honest with ourselves, and then go to someone we trust and talk about those things, not particularly about our preferences at the point, but talk about, what's happened to you in life and what kind of emotions that you're experiencing through it right now and how it's impacting. When it impacts your daily life, then it's a big issue. I don't know if I'm being as clear as I really want to on that.
It's the $64,000 question, really, isn't it? If you can't go to a therapist and talk about the fact that you feel you've been traumatized and you're struggling with same-sex attraction as a result of it, then it's a difficult walk, and it's certainly going to be a process, surely, of a person taking control of the direction that they want to go in. If they've got goals in terms of what they want to achieve in life, they want one day to be married, they want one day to have their own children, then there's steps of action that they're going to have to take. And if they can't get the help from professionals, well, they're going to have to look at all sorts of other options, re-education, social networking, group work,
Yes.
women's development work, or women working together to develop themselves. Anything surely that is going to put the shattering back and increase the self-esteem and the self-respect.
Exactly. So I wanted to mention a couple things for those who are watching who may be younger, and just talking about brain development. And one of the things that's important to realize is that the teen brain develops over a decade. So the CEO, the chief administration officer of your brain is not fully developed until you're in your mid-20s. And so what you experience in those years changes your brain. What you think on changes your brain. There used to be a saying, well, be careful, little eyes, what you see, be careful, little ears, what you hear, because, and why do we do that? Because we understood, my grandparents understood that what we're exposed to in life has an incredible effect on our future. So here's, when you talk about steps, if you're heavily involved in watching porn or reading, porn magazines or whatever, usually now it's all online, but the first place to start is to stop doing that. And there are online groups that will help you, that really will help you modify and eradicate the desire to look at porn, because it is like what I was saying, it tracks so quickly on the brain, especially in those 11, 12, 13 to 16 years, which is exactly the years which most children get involved in pornography. So training the brain means that you have to extinguish some kinds of behavior if you want something different, and you need to practice new kinds of behavior to create new neural pathways in the brain. And you can do it. You can do it. That's how we teach. That's how old people like me can learn to play the piano. Not that I have yet, but we can learn new skills, technological skills. I'm a long way off from where the teenagers are. That's okay. I'm still learning. And so don't beat yourself up if you don't get it right. It takes time to create new habits in the brain. And yes, go ahead, Mike.
Now, those new habits, I'm assuming that's about replacing the porn or whatever it is that has become so entrenched in our behaviors. It's displacing it, because
yes,
to white knuckle it and I'm going to quit porn, and then for a week I survive, and I don't do it, but then after a week I go back to it. So it's something has to take the place of it.
yes, and I mean distraction and other things, but the sexual things are still the most difficult to treat, right? It is the most difficult to treat. That's why not getting involved in those things early on in life is so much better. But that's not the case of our society and our culture. So now we have to treat, we've created the greatest mental health crisis the world has ever seen. In the last 40 years, we've been creating this mental health crisis. And people will take offense at that at some level, I suppose, but it's true. What have we been teaching our children? And so is it, and I'll be blunt here, if we're teaching 5-year-olds how to masturbate and to enjoy that, what do we expect when they get to be 16 years old and they're, and you find out that they've raped, an 8-year-old? This is happening. And because here we go, the 5-year-old then who's grown into teen years, we as human beings want more. right? The addictive quality. We want more, we want new and exciting things, and it just keeps exploding. And it's so hard for us to change. But, I want to bring in the God factor.
Mm-hmm.
We are not alone. We are not alone. And I have heard story after story after story of those who actually have probably been so far on this side of the sexual continuum, so to speak, in promiscuous behavior, all that, who have just had interventions from the Holy Spirit. And I'm not saying just, but that intervention is wonderful. But if they do not remove themselves from the places of temptation, it is highly likely that they will revert back. Like, we just have these things. So we need to really, having an experience with Jesus changes our world, a really, really deep experience. And for most of us, it means we never want to go back to where we were.
But isn't it? I mean, that intervention, when people find the Lord and when repentance is real in their life, there's also a transition into a new group, a new peer group that is surely totally opposite to what they have experienced in terms of where they've come from. I mean, I suppose it's common sense, but people cannot be on their own. Isolation is a real problem, isn't it? So when we're looking to come out of this, it is about forming a new community, coming into a new community. And for folks who find the Lord and discover, other believers who've gone through similar things, that is a huge advantage.
It's tremendous. It's tremendous. And, even if perhaps you find a fellowship at church that no one's gone through quite what you've gone through. And of course, that's true of every single one of us. We never walk in anyone else's shoes. We walk in our own. But, if you find a place like a church where you're just loved for who you are, and that people can know everything about you and still love you, wow, how transforming that is, especially for someone who's never experienced that depth of love and compassion. And it's not an expectation of perfection because we're human, but it's this sense where, we just want to love on you and we want to help whatever way we can.
So the gospel is therapeutic. In other words, it's back to the fact that help that is truly therapeutic can come also from the church and from within people who are just concerned about other people and supportive of them in their journey.
Exactly. And I think that the church has always, to me, been like a hospital. It's supposed to be working like a hospital, that people in the church aren't perfect. We all come with baggage. It's what we choose to do with the baggage. I just share this little story. It was so precious to me. It was a 9-year-old child, and her mom was bringing her, and I'd seen her mom and her dad separately. They were going through a divorce, very contentious divorce. But then the child was experiencing some stuff, and they asked if I would see the child too. And I usually see children with their parents, but this time I really felt I just needed to talk to the child, a little bit. And this children are incredibly spiritual. You give them the opportunity to talk about it. And when I said baggage, this is what it reminded me of. And we were talking about what was going on in her home and the experiences and what the level of anger and all of that stuff. And she said to me, "It's like I have this heavy backpack on my back, I said, wow, that sounds pretty, carrying that around all day. Oh yeah, it's filled with rocks. And it was just thinking about what does that feel like? What does that look like? And so we talked about how heavy the rocks were and what the rocks were. And they were the anger, they were the fears, all these rocks were what she was experiencing and the great grief. And because of her involvement in a church, this is so interesting. And she knew the gospel. This was a child 9 years old. And I just said to her, what do you think Jesus wants us to do with rocks like that? You have such a heavy load. And she said, oh, and she kind of dropped off her chair and she started crawling across the floor. Children are so expressive, right? And I said, so these rocks, you can't even stand up under the load, right? And she said, no, it's so heavy. And I said, but where are you going? I'm going to cry. I'm going to the cross. And so I had this amazing privilege with this child to help her metaphorically. She's crawling toward what she is seeing in her mind as the cross of Christ. And to metaphorically take rocks out of her bag. And I could help her. I asked her, can I help you with that? And she was so willing. And so we just did this as kind of a play experience, I guess, and taking the rocks out, and she would name them and put them representationally at this imaginative cross. And we did them one by one. And then she stood up and she took the backpack off. And that child, I don't know who was more emotional with that experience, but she began to dance around. And I think, when Jesus said, if you become like a little child, we need to strip away all these thoughts and all this condemnation and everything that other people are putting on us, and take the rocks, the backpack that we have, the burden that we have, and take it to the cross, because Christ forgives us of whatever we have, the hatred, the bitterness, the anger, all of the things that we have ever done, we take to the cross. And not only that, we can take to the cross the things that have been done to us, as this child did. And they were so tremendously healing for her. And I think those experiences, if we begin to understand them individually and begin to see what can happen, it's tremendous.
So there is indeed hope. Dr. Ann Gillies, thank you so much for your time today, for sharing. I'm sure there's going to be many questions, but I wonder if you couldn't pray for us as we close the program today.
I'd be very privileged. Heavenly Father, those who might be listening to this program, those who are carrying bags full of rocks from whatever experiences they've had in life. And maybe they've already come to a place of acknowledging who God is, and maybe even to the place of accepting Jesus as their Savior. And I pray today that they would make Jesus Lord of every area of their lives. Lord of their mind and their will and emotions. Lord of their sexuality. Lord of everything. And Lord, right now, I just pray that each person listening would take that heavy weight, that bag, and throw it to the ground and leave it at the foot of the cross. symbolically walking away from the bondage, from the chains that bound us, and then walking into the new light and the new experience of Jesus and everything that he wants for you in your life. God, may you lead us to the cross. May we surrender there. And may we take up your word, which is called the sword of the Spirit. And may we read it. May we ingest it and digest it into our lives, that it would continue to set us free. And we ask these things in Jesus' name. Amen.
Amen. Thank you so much, Anne, and God bless you. We look forward to seeing you again at some point. Thank you so much for what you're doing in terms of defending the gospel